Hey guys, in this video I'm going to be going over what mild asthma is. My name is Justin Vandermark and I was diagnosed with severe asthma, which I now knocked it down to moderate asthma. Kind of borderline, but let's just jump right into what mild asthma is. There's two different types of mild asthma. There's mild persistent and mild intermittent. Intermittent's the lowest on the spectrum for asthma. Most people that have it don't realize they actually have it. That's why majority of the time it's untreated. And what that is usually you'll have an asthma symptom about twice per week, and or you'll have it at night twice per month, and that's like the definition of what mild asthma is. And ranging on that, the difference between that and mild persistent is that mild persistent occurs more than twice a week, but you're only having one symptom per day. So whatever day you do have an asthma attack, it's more than twice a week, but on that day you have it, you're only having one symptom, no more than that. So for the symptoms of intermittent asthma, for mild, it's going to be wheezing, coughing. You're going to have the swelling of the airways. You're also going to have mucus buildup. And the only difference between that mild intermittent and mild persistent is that persistent actually has chest tightness and chest pain included with those other ones on the list. So the treatment for both of them is using your rescue inhaler, your fast acting inhaler. I have albuterol. That's what I use when I'm having an asthma attack or my swelling of the airways. I just couple puffs of those and it'll alleviate those symptoms. And then also consult with your doctor if you have it, or if you don't know if you do have asthma. Consult with a doctor. They can tell you where you're at on the spectrum, how you should go about for medication, as well as getting an asthma plan, asthma action plan. So for both mild persistent and mild intermittent, it both has symptoms for asthma, and a way of increasing those symptoms, in a bad way of course, it is pollution or fumes, it's being overweight, it is tobacco smoke or secondhand smoke, it's also allergies along with occupational. So if you work, you can get some fumes or pollution from that, which will also affect your symptoms or trigger you. And last but not least, it's a rare one. It's not super big, but it could be from history, family history. It could be passed down, and you can, if you have a family that had it, a mom, grandma, then yeah, it could be passed down. But again, like I'm saying, it's really rare, so it's not that big. So if you're liking this information, please hit that like and subscribe button so I can keep on providing this asthma information. And if you want any other type of health tips, health information, put it down in the comments below and I will research it and have a video on that for you guys. So thanks for watching. Can't wait to see you guys on the next episode. Thanks, guys.